Welcome and thank you for participating today. Before we begin the webinar, there are a few housekeeping items to review. Today's webinar is being recorded and will be posted within 5 to 7 business days on our website at greatplainsquin.org. All lines will be muted throughout the presentation. The chat box is located on the bottom right side of the screen. Please feel free to post questions and they'll be addressed at the end of today's presentation. My name is Stacy Fredenberg and I'm the Communications Manager for Great Plains Quinn, South Dakota. Welcome to Facility Branding, Identify and Impact Public Perception. This webinar is presented by the Great Plains Quality Innovation Network, the Centers for Medicare and Medicaid Services Quality Innovation Network Quality Improvement Organization for Kansas, Nebraska, North Dakota, and South Dakota. Our mission is to achieve the aims of better health care, improved health, safer care, and lower health care costs. An organization's reputation is formed based on a combination of public image and personal experience. Perception is impacted by a variety of elements, from physical space to interactions with employees. An organization's mission and set of values only contributes to the brand when they're brought to life through personal engagement with the employees, products, and services. With that, I'd like to introduce our speakers, Becky McElroy and Dr. Nathan Unruh. At her core, Becky McElroy, Chief Marketing Officer for Patient X, is a creative, but there's much more to her than meets the eye. She was formerly trained as an artist with an emphasis in graphic design, but her curiosity and passion for learning have had a great influence on her career. She claims working in design and marketing has been like an encyclopedia to the world because she's learned many things she wouldn't have picked up elsewhere. She has found her greatest enjoyment in learning about people and ideas, fostering relationships with clients, and creating meaningful designed campaigns. Thanks to her depth of experience and mastery of design and strategy, Patient X is transforming healthcare by using marketing to improve the patient experience. Dr. Unruh is the Chief Executive Officer for 5-4, which offers interactive online training based on the principles of competency, culture, and customer experience. He's also the Chief Experience Officer at Sidecar, a community of chiropractors who provide training and mentoring in their profession. He maintains his original venture as Director of Chiropractic at InVive, where he manages multiple locations that serve thousands of people each month. He's the author of Lavender Morphine, Digit, Chrome, and Strike It. When he's not working hard to help patients and colleagues, he's spending time with his wife Sarah and their 3 children, Gabriel, Lincoln, and Alexa. He's also an avid golfer, sports fan, reader, and writer. With that, I'll turn the presentation over to you, Becky. Thank you.
Thank you, Stacy, for having us today. I'm pretty excited. This is actually my first time to do a webinar, and it's great to be able to do it with Dr. Unruh, and who has had a lot of experience. And so I'm pretty excited to talk with you today and give a little bit of my experience and knowledge. I'm used to just kind of sitting behind the computer, like we said before, and creating the brands for our clients, and so this will be fun. So I want to first start by talking about brands and what specifically a brand is not. A brand is not just the logo. It's not just the website, and it's not just the business stationery or your signage or your promotional materials. It goes much further beyond that. By Merriam-Webster's dictionary, a brand is a mark made by burning with a hot iron to attest manufacturer or quality or to designate that ownership. We do not advocate burning your brand on to your patients. So a more appropriate definition in a way would be a public image, reputation, or identity conceived as something to be marketed or promoted. So what we do here and what specifically a brand is about is actually a brand really lives in the mind and the heart of the patient. What we want to do here is create that emotional connection with our patients so that we can basically, in that mind, burn that brand into their mind.
You know, Becky, I'm going to question you real quick because you just made me laugh with stuff. So I think for everybody listening, a definition that brand exists in the mind and the heart of the patient, we can't stress that enough. I think it's a brilliant and simple statement. But when you said we don't suggest that they burn it into them, but if they did, you know that brand truly hit them home. I love the story of Harley Davidson, that they said they knew they would arrive when their brand started to get tattooed on their diehard clients. So I think, even though I appreciate your humor, isn't that what we should strive for? That we have people so endeared to our organizations, they'd be willing to put it on their skin.
Right.
Yes.
Right. So, in that case, yes, it goes to that highly emotional level. It's a very intangible and powerful aspect when you have a strong brand. Switching my gears here. So I like to kind of tell a little bit of a story. In the beginning of my career, I started and worked with a marketing company. We were pretty good at what we did, I thought. We were hard workers. We went out of our way to take care of our clients so that we could see those clients grow and become successful. Our brand itself was a good brand, we felt, until one day we kind of stopped and asked ourselves, just like a lot of you ask yourselves, well, how do we set ourselves apart? How do we set ourselves apart from our competitors? And what makes us different? Why would a business want to use our marketing services when they could go down the street and work with a multitude of other marketing firms? All of us just trying to make our customers successful and do what we have a passion for. So that's where we started to change our thinking. We decided it was time to stand for something bigger than ourselves and the daily tasks that we do. So we took a look at our brand and asked, does this brand really align with our customers? Does it resonate with them? Do they feel and experience our passion for marketing that we do every day? So I know this kind of sounds odd that a marketing company that teaches and tells our clients every day how to be different from their competitors, and we were asking ourselves the same question, but I tell this so that I can illustrate that value of a strong brand, one that aligns with its customers, one that touches them on that emotional connection and builds those relationships so that they do start tattooing your brand.
I love it. Yeah.
So while at this company, we discovered that our brand really didn't resonate with our clients. They didn't see and understand the mission of the company that we were working in, and our internal team as well was kind of lost and didn't identify with our company itself, which is a big problem. So that company I worked for now, long ago, is gone, and we've moved on. I've moved on. But you're probably wondering kind of what became of that company. That company actually turned into Patient X. And that's where we really, truly started developing our mission and our vision and where we wanted to go for our company, and making sure that our internal team knew where we were going and how we were getting there, and really aligning all of that with our customers. So I tell you that story so that we can first look at 4 different ways to measure your brand. I should say 3 areas. The first is the awareness and use. The second is the brand positioning, and then brand delivery. So on awareness and usage, we want to make sure that our patients have if they don't have an awareness of your brand, they can't consider it. You want to measure those awarenesses and use that as a critical component of that brand health. For a brand to do its job, it needs to stand to reason that people must know about it. But that's not just enough. Organizations must consider their target audiences in the broadest sense and also take their other key stakeholders into account, including those influencers, decision makers, approvers, and users. In the brand positioning, your brand has to stand for something. Again, like I mentioned with Patient X, we didn't necessarily stand for anything in particular when we were just the marketing company we were before. So our passion really lent to the healthcare and changing the way patient experience is within the healthcare industry. The positioning of a brand is linked to the brand benefits, perceptions, and associations, relevant to the needs of the individual and their businesses. It clearly and distinctly is different from the competitors. It's credible and consistent across all touch points and experiences of the brand. With brand delivery, it must live up to its promise and deliver that promise. And it really boils down to the one word, consistency. Consistency means that your brand's positioning has the chance to transmit loud and clear through the noise of business life to mean something rather than nothing. Consistency of message, consumer knowledge, and experience lends credibility and ownership of your brand positioning. Consistency means that every single experience of a brand should fit together as part of the same entity. From the first time a brand name passes your eyes, from an event through a patient walking through your door, every touch point should be consistent. Here at Patient X, we do specialize in healthcare marketing, and we really align our 5 key areas to create that better patient experience. We focus on website health, the cultural index, patient surveys, social online reputation, and brand health. Together, those 5 areas we feel create that strong patient experience. For today's purposes, though, we are just focusing on that brand health and the cultural index. So I want to just talk a little bit then specifically in those areas, and then kind of hand it over to Dr. Unruh in talking on that cultural side and how that affects the brand and Bill.
Well, great job just leading into the next component of this discussion today. So just for a second, as you think about what Becky said, I think it's always a good exercise for me, I know, to do this, and I want each of you to do it with me. So just bear with me right now. So you ready? 7, 6, 5, 4, 3, 2, 1. You see, in just 7 seconds, when somebody encounters you, they've already judged you, they've already looked at 11 different metrics to say, I want to do business with you, I want to see you as my healthcare practitioner. That's how long we get. And so I love what Becky kicked us off with, and said a brand exists in the mind. And in the mind, when we look at the studies there, that we have 7 seconds. 7 seconds by which the consumer gives 11 different metrics that they've already prejudged us. Yes, it's not right to judge, I know, but here's the reality. We all do it. So I think if we can be more intentional about that, so all the way down to what does the parking lot look like? Are the stripes bright yellow? How do they, when they call on the phone, how are they welcome? How are they welcomed on the phone? When they walk into the front door? All of those components make up our brand. And so as we look at the slide that you see in front of you right now, where we see the brand and the culture. And culture is a funny thing, because I think when we talk about culture in organizations, we think of Zappos, right? The nice wide open areas. There's ice cream on Wednesdays, beers on Fridays. You can wear jeans or what, it's that type of, that's culture. But here's the reality. True culture has some key components. And if there's nothing you take away from this discussion today, my hope is you take away this. Culture is made up of clear alignment within an organization. Clear alignment from the very top to the very bottom, knowing that you don't need a title to be a leader. Because I love what the Cleveland Care Clinic was still considered one of the best patient experiences in the world. They call their caretakers, the people that are taking care of patients, they consider all the way down to the people that are the beautification of the premises. It's part of the patient's care of how the bushes are trimmed and how well the parking lots are manicured. They include everybody in the organization, the custodians, not just the doctors, not just the nurses, not everybody is a part of that patient experience. That's aligned around a very clear culture. So in order to have a clear culture, you have to establish key components. Number one, vision. We walk into a lot of organizations and we watch, well, what's your vision? And they kind of look at each other and or they'll point to a wall, or it's this very long statement that nobody can remember. And really a vision is your why statement. So I'll give an example of Apple. You know, we all know Steve Jobs. His vision was very simple, to put a dent in the universe. Very idealistic statement, but something that everybody at Apple could rally behind. It wasn't about creating cool computers. It was really, truly about putting a dent in the universe. You know, another great example of one of the organizations I'm involved with, the vision is to enhance millions of lives. That's the vision. If you ask anybody in that organization, no matter where they work in that organization, that's by the lens by which they look. Now, if you then drill deeper into it, how are you going to execute on that vision? And that becomes your mission statement. That's the how statement. So how you're going to enhance millions of lives, maybe through creating unforgettable or memorable customer experiences. Crystal clear. Everybody in the organization, whether it's an organization of one or an organization of 1 million, gets clear around the vision and the mission. And once those two things get very clear, then we come to values. What are the values? Now, you know, when we work with organizations, oftentimes we say, well, it's integrity, it's honesty, it's happiness. Well, all those things are great, but what do they really look like? And are we individually behaving that way, and are we collaboratively behaving that way? And then how do we protect that culture? So, for instance, we recommend 3 key values that organizations can rally around that everybody in the organization knows. So one value that an organization we work with is an ant colony. That's one of their values. What does the ant colony represent? It represents the ant. And an ant working within a colony, if you know anything about an ant, it can lift up to 50 times its weight. So it speaks to its work ethic. It also speaks to the fact that an ant has no governor and it has no prince. So it doesn't need to be told what to do. It has clear accountability and understands that our job is to dig tunnels and to store food. And if somebody knocks down one tunnel, we're going to come together as a group and we're going to build another tunnel because we're an ant. So again, that kind of mentality of work ethic and looking at an ant as one of their cultural values of behavior allows that, hey, in this organization, if you can't work like an ant, you're probably not going to last very long because they protect that culture. So again, the value there is that strong work ethic. But no, you want to give it a word picture. And ant colony represents one of the key values of that organization. Let me give you another example. A whiteboard. Well, a whiteboard's a value? Well, yes. You know, when people ask me this, the whiteboard can represent innovation. That this organization will never stop innovating, never stop getting better. And so a whiteboard represents a value. So just to review that, from a culture perspective, the key elements within a culture, making sure you have a strong vision that everybody in the organization that knows. And the vision statement's not just something to put on a T-shirt, on a website, or flash on. It's truly something that lives in the hearts and minds of each of the people that are in the organization. They understand why they put their feet on the floor every morning and come to work. And what they do is a big deal. especially when we're talking about healthcare. These are people's lives, sick lives. These are moms, dads, kids that we're taking care of. And so therefore this vision and us walking and taking that very serious is so critical. Coupling that with your mission, coupling that with your values, and then protecting it with what we call a code of honor. Code of honor would be 10 statements. Statements such as, patients come first, have each other's back, celebrate all wins, be willing to be called and call people on the code. And so therefore somebody's falling outside of the behaviors that team member, hey guys, I got to call you on the code because you're not adhering to X, Y, or Z of our behaviors. And then lastly, the accountability ladder. It's a simple tool. And I don't want to get into the weeds on this, and we're going to make that available to whoever's on this call today or who is listening after this call. We'll provide you what we call a success roadmap. And in that success roadmap, in fact, I think, Becky, why don't you share Patient X's with them? Because I think when you talked about your story of Patient X, that was one of the key items that you guys did that I think has been very important. I think if you submit that for everybody to see in addition to the accountability line, that would be helpful. Did you do that?
Sure.
Yeah. So if you look at those two, understanding what a brand is, it exists in the mind and the heart of the people. You got 7 seconds to make that impression. Everything that they see now when they come into your facility, every touch point, how clean is it? What's the bathrooms look like? What do the uniforms look like? Do you have a name tag? Are you first aid ready every single day when you come to work? All of those touch points, that's marketing. Because those are the intentional pieces that make up your brand. So being very intentional. And now what we always recommend, we'll measure it. Let's measure our brand. That's what I love about the Patient X score, Becky, that you guys have done such a nice job with us. Let's measure where we're at, because if we can't measure it, we can't monitor it.
Right.
And so then what we end up doing is we go put up really cool billboards or new ad campaigns and stuff that really, where the magic is in the trenches. How do we look at the little details? Because it takes very little to be above average. And if we want to stand out in today's marketplace in healthcare, patients are demanding experiences. We see lower reimbursement. We see more information out there about our health, more than we've ever seen ever in the history. People are on the internet nonstop. When they come, they're comparing their experience in your facility, not with their last healthcare experience, with their last best experience, whether that be at a Starbucks, a Four Seasons hotel, a local bed and breakfast. That's the kind of experience people are craving. And they're craving it in healthcare. Because, guys, there's 2 institutions that have done a really poor job over the years. Banking and healthcare. Because we've gotten really a little bit sloppy. And so this is what a tremendous opportunity for everybody on this call to take a strong look at this and say, okay, how are we going to make ourselves special? So I want to go to this next, on this next slide, what I want you to see here is that here's the 4 top complaints by patients. Because here's the tendency, is we have a tendency to see the world through our own eyes. It's important for us to take a step back and say, okay, what are patients saying? We've done thousands of focus groups. You can go look at the data here. You can look at the data that's on here. It comes back to the same things. And I don't care if you are a chiropractor, if you're a family practice, orthopedic surgeon, urologist, dermatologist, whatever the widget is that you're providing within healthcare, these things still come back to the same thing amongst patients. So number 1 complaint is billing is unclear and hard to understand. I'm waiting too long to be seen. Those are the top 2 right there, guys. Those are the top 2. I love the doctor. And, oh, man, the staff is awesome. But you know what? They screw up my bill every single time. Then when I call to try to get it fixed, their service is so poor. Anybody ever heard that? So I mean, so if that leg of the stool, the billing leg of the stool, falls off, that doesn't endear people to your facility. Giving them clear expectations of what their coverage will be, putting the systems and procedures in place to give the patients the information they want and desire and deserve. Right? They're spending a lot of money for our services. If we can be very transparent, boy, that just creates the confusion. And when we can decrease confusion, we know that a confused mind always says no. So the next time they have a choice and they have a need for your facility, how did we do last time on the billing? How did we do in honoring their time? The businesses that are really paying attention to this idea of time, because we are in a fast society. We want things now. Healthcare is no different. I saw healthcare facilities that a group of doctors made the decision. We will make the commitment that we will see our patients within 15 minutes of their scheduled appointment or their appointment is free. Now, I'm going to tell you, when they made that big claim, there was an absolute uproar in the organization. You're crazy. There's no way you can do that. But when they got intentional and started focusing and started getting rid of needless things that didn't add to the patient visit, they were able to execute on that. They had happier patients. They saw more patients. And all of a sudden, then the organization's high-fiving them. Again, like I love what Walt Disney said, sometimes you got to jump off a cliff and grow wings on the way down. And sometimes, Walt used to say, Walt, you got to think outside the box. He goes, oh, ladies and gentlemen, there is no box. So we are in completely uncharted waters right now to really craft the patient experience that is so memorable. So the third thing here is I can't find resources to meet my needs. Becky did put up a resource there on the slide and just talked about your website help and some of the things, different resources you can provide as an organization. How are you delivering those resources? Are they easy to find? Are they delivered in such a way that are meaningful to the patient? Do they have long words like supercalifragilisticexpialidocious? That means nothing to the end user, right? So how are we delivering those things? And then the last thing here is my needs aren't being listened to. Guys, the number one reason people leave a place of business, especially in healthcare, to the tune of 68% is this last one. It's due to perceived indifference. Perceived indifference is treating people like robots. When they walk in, we don't rise from our chair. We stare at a computer. Name, please. Insurance. First question is, insurance, please? How about, what's my name? Show some care for me. Are you even listening to why I'm here? The average doctor interrupts the patient within the first 13 seconds. And for you that are doctors on the call or understand anything about when we are looking at diagnosing a patient, we find get 85% of our diagnosis from taking a great patient history. In order to take a great patient history, we have to listen. So what are we doing in training our teams, all the way from the doctors to the nurses to the people answering the phones, to be able to capture the information needed to deliver a memorable patient experience? So my challenge and encouragement to you all today is look at these 4 complaints. How is your organization doing? Do any of the things that I've said strike a chord and resonate with you? Because there's such a tremendous opportunity to make a change. So how do you make a change? Here's the reality, ladies and gentlemen. You can't create a world-class patient experience without a world-class team. And you can't have a world-class team without world-class training. So there's 4 key components to every good training and business development system. Number 1, do you have great content? Great content is something is quantified by does it get results? Because if it doesn't get results, it's not great content. So that content around your billing services, how we communicate with patients, what's training around how patients are, what's the flow like through the office or the facility. You know, how about simple things such as the 15 and 5 rule, meaning if somebody gets within 15 feet of you, you acknowledge them with an eye glance and a smile, just like Becky did with me just now. And if they get within 5 feet of you, you introduce yourself. You introduce yourself and who you are and how you're there to help. So it's simple trainings of great content to teach people how to deliver these unbelievable patient experiences. So again, you don't, depending on the training system that you have, here's the criteria I said, whoever you use, whether it be internally, externally, or however you're developing your system, you don't have to hire us, but you have to have these 4 criteria. Number 1, great content. Number 2, repetition. Because right now, on this discussion, I hope you're getting some things from this discussion today, but this is the reality. This isn't really training. This is exposure. We're going to probably hopefully expose you to some thoughts and ideas, but until you take this information and get some repetition with it and start drill down, it's really not training or development. It's merely exposure. And so you have to have repetition. And Tony Robbins says, repetition is the mother of skill. Does your current system allow for repetition? So for instance, in a number of doctor's offices and facilities we use, they have 15 minutes per day that's required to do training. And that training is done in 3 to 5 minute increments that's tracked and monitored. So if you can't track and monitor it, how do you know anybody's doing it? And it's 15 minutes a day, not just mountaintop experiences where you bring in a trainer in once a quarter or once a year and then hope to God some type of organizational change is going to be made. It won't work. It doesn't work. And I felt that frustration in the organizations that I've been involved with, and I'm sure you have as well. So again, great content, repetition. Number 2, role play. Are you ability to role play it? Role play it interactively within a system. Role play it on your own teams, in your little small groups, with your direct reports, or however your organization is designed. You've got to have a development system and training resources that you're able to role play with the team. And then lastly, again, accountability. If you can't track, measure, monitor it, it's not good. And so, for instance, I get an email every single day of my different organizations, who trained, who didn't train. I get a report every week, who trained and who didn't train. And that's, when you have that type of system put in place, that's how you keep sharper than the sword. That's how you stay in front of the competition. That's how you create memorable customer experiences. And you can't do it unless you develop a world-class team. So let's look at things like patient experiences. I want to tell a quick story here just for a moment. You know, there's a facility that takes care of patients. And this young lady had come in, and she was a special needs little girl, 13 years of age, brought in by her mom. And she had a complaint of upper back and neck pain. And this upper back and neck pain had started to limit her ability just to enjoy the life that she wants to enjoy. And one of those things she enjoyed was bowling. And she would go to the bowling alley twice a week with her mom, and she would laugh, her mom would have fun, but all of a sudden this bowling alley no longer had the 7-pound bowling ball. And so she'd have to use a heavier ball, and made her become more in pain for her condition of her scoliosis. And so bowling wasn't as much fun anymore. Well, within this organization, they were empowered and trained on a system that they were able to wow a patient either with time or money up to $100 per month per employee. Now, some of you guys are going to freak out. I'll explain it to you in a minute, but just bear with me for the story. So this young lady came in at her next visit, and a member of that team bought this young lady a bowling ball, a 7-pound bowling ball wrapped up with a bow, Also, they put in her favorite meal inside of it, which was a box of macaroni and cheese. That doctor of that facility got two of the most endearing notes that he could. He said, I couldn't have paid for this advertising from both the mama and from the little special needs little girl. Total all-in cost, about $60 with the mac and cheese included. So that is an example, but that would have never happened unless that young lady on that team was empowered to do that. Now, in that organization, I've seen organizations of well over 150 people incorporate much of the similar type of attention to detail. They never spent more than $600 in 1 month. Just the awareness, the ability to be able to do that. And here's what it does for a culture. I don't know about you or me, but I sure not have to work there if I could do that kind of stuff. You mean I don't just have to bang at my EHR all day? I can actually try to wow patients. I can try to really love on them and create amazing patient experiences. That sounds like fun. So think about that. The other thing is that this is another idea and tip. Look at the size of your current organization. Do you have 5 people? Do you have 25, 100? Talked to one this morning, 2,500 employees. What if every single time they got paid, they would write a handwritten note to the people that they serve, just thanking them? So if you have an organization of 100, that means every 2 weeks, 200 handwritten notes would go out to the people that you serve. I don't care, you can't buy better advertising than a handwritten note. Harvard still today, at marketing and business school, says the #1 marketing tool an organization can do is a handwritten note. Why? Because for 2 minutes, you have to think only about that person. So it might sound like this. The nurse or the gal that is answering the phone had the opportunity to take care of little Mary that came in with the flu, and they get a note, hey, it's such a great opportunity to meet you and your husband and take care of little Mary. That's your last visit. We appreciate you. Find that person's name. Those little things go a long way, and it doesn't, again, it takes very little to be above average. So I challenge you and encourage you today, what are those things right now? I've given you, #1, you can't create great customer experiences until you take a real strong deep dive at your current culture. How are you currently measuring your overall brand? Are you taking a hard look at what people are saying about your brand? And so, let me look at your screen right now and ask these questions. Are your key investors your biggest brand advocates? If you will go to the CEO, or you would go to the person answering the phone and I'd ask them in separate rooms, what's the vision of your company? And you don't have a succinct statement, I'm challenged you to get succinct. Get in alignment. Get the boat in the water, everybody's oars in the water, and let's start rolling in the right direction.
I always kind of like to use the analogy that you used Steve Jobs earlier, in that key investor of that company, Steve Jobs, what if he didn't actually use Apple products? What if he didn't really believe in Apple products? What would have happened to that company?
Yes. Yeah, so the very first fail was yourself. Yeah, would you get care there? What I actually want to refer and recommend, right? Mm-hmm. So do your key stakeholders believe in the brand? I think great, brilliant point, Becky. If we talk to people, listen, are we the resource? Are we the thought leaders? And do we walk the talk and talk the talk? And are you thinking about what your patients' wants and needs are? Again, sometimes we have a tendency to only peer through the eyes of regulation and compliance, which, don't get me wrong, don't mishear me, it's so critical and so important. But right now, we got to make sure that we really are listening to the people that we're serving. And how are we creating systems and procedures, training and development to drive home a strong culture of learning, culture of training, culture of constant innovation, quantification, and orchestration to memorable customer experiences day in and day out.
Thinking about your patients and what they need, one of the things that I see a lot in the branding world is that our customers themselves, they may have likes and dislikes, and they believe so much in their company and their brand themselves, and yet they lose sight of who their customer is and who they're trying to reach, whether it's a patient or whatnot. And so they start to want to build their brand off of their likes and dislikes versus what their customers are really wanting and needing.
Absolutely.
And as soon as I can get, and we can as a team get them to see beyond that, there's a major shift.
Absolutely.
And the brand becomes that much stronger.
Yeah. So how do you do it? So let's go to the next slide here. So 4 ways to start creating better patient experiences. So assess where you are, right? If you don't know where you're going, any road will get you there. So, the strongest companies, have live by the H3 formula: heart, humility, and hustle. The heart is, are you truly want to give a better patient experience? Humility is, are you humble enough to take a step back and say, I want to expand my mind, I want to learn, I don't know it all. I would expect you to say, I got to be smart guys, and I got to change rooms. Right? Let's figure out who's doing it well, and how do we emulate it. And then hustle. Are we going to be willing to put the work in to make things happen? Because it's not easy. But if you want to be better than everybody else, you're going to have to put the work in. So assess where you are. And the best way to, what is going to give the organization the best outcomes? So where are your gaps right now? So Patient X put together an amazing assessment, request an assessment. Assess it. That would give you a good starting point. Then you know what to do. Also, I created here this 100 patient experience design ideas with our team. And these are things that experience design ideas. And every one of the 100 will work in your organization, but we do this in all kinds of healthcare, from eye doctors to orthopedic surgeons, chiropractors. These ideas work in all different kinds of healthcare. So go to that. That's something you can have. It's free to you. So those are the couple things I would do. And what I want you to do is I just want you to picture a day where wherever your facility is, that each and every patient, whether they're seeking care in your facility or not, that when they need you, they choose you because of your strong intentionality of all these key components. If you want to be relevant in today's marketplace and you want to go to the next level and be ahead of the curve and drive strong organizational health, pay attention to these things. Pay attention to your brand. Pay attention to your culture, and make sure that you develop strong training and development system for your organization. I know your communities will appreciate it, and your organizations will thrive. So thanks for the opportunity to be here today.
Thank you. This was fun.
Yeah.
Thanks to both of you for providing such great tips and examples of ways that you can impact your patients and provide a great experience. I'm wondering, Becky, can you talk a little bit more about some of the ways that you work to identify what the current perception of an organization is when you start the process with them on working with their brand?
So here we typically start not just with brand, but those 5 pillars that I showed earlier, which was the brand health, cultural index, our social reputation, and patient surveys as well with the brand. So we have a system Dr. Unruh mentioned briefly was our Patient X score, and we have a method that we go through and we collect data, basically. So there are different aspects within all of those pieces that we're looking at on when we do that score for our facilities. to see kind of where those gaps might appear in the data aspect. From a brand perspective, though, again, we go back to the awareness aspect. Are you seeing that your the consistency piece? I hammer home so much about that is that are you using not only your brand mark consistently? You know, are you changing colors on it every day? Are you using materials that are using your corporate colors from your signage? Is the messaging behind all of that, is that consistent? And are we talking the talk and walking the walk in that consistency? Those are some kind of those pieces on the brand aspect, but we do look at overall from the marketing perspective all those 5 areas and develop so we can kind of see, is the website, is that website health, is that in a poor state that's influencing that patient experience? Are they not able to find the resources that you've created and that are there, or do you have some social reputation that you need to clean up? I hope that answers your question.
I just want to yes, that did. I just want to remind everyone that if you have a question, feel free to add it to the chat box, and I will make sure that we ask them of our presenters. Dr. Unruh, I know that as you've gone through the changes that within your organization, that sometimes it can be challenging to get your staff all on the same page. Can you talk a little bit about some of the ways that you engaged them in those initial phases, and maybe some of the challenges you faced as you were, making your culture and your brand?
Well, Stacey, it's great, brilliant question. It's easy, Stacey. They all love change. They just are so happy to make the change.
I don't.
No, I use this analogy because it's not easy, but I think that every single one of us as human beings want to know that we matter. And so I think as you're making a cultural change, it's so critical that people understand that they do matter and that they understand the why behind the what. So for instance, if you walk into an organization and we've had people do this and it's a huge mistake, so don't do this, and says, we're going to start training more. We need to train more. We need to get better. We need to get better. We need to train more. Well, if you don't give them any context, nobody wants to train. When I bought my treadmill, I didn't really want to get on it. But what I did want is I wanted better health. I wanted to look nice. I wanted energy. So therefore, what I wanted, it was going to be a necessary evil. Another analogy is if we run down to the hardware store and to buy a drill bit, I buy a drill bit to put a hole in the wall. I put a hole in the wall because I want to hang a picture. But just not any picture. I want to hang a picture of my family. But it's not just about a picture of my family. It's that, Stacey, when you come over to my house, I want you to admire a picture of my family. So really, it was never about the drill bit. It was about the picture of my family, and you admiring it. So why I give you that analogy as leaders of your organization, it's our responsibility to say, what's the picture of the family you want them to admire? What are we trying to accomplish? Because if you could get them to understand the why behind the what, now when you give them the drill bits of the training and the development and the changes that need to be made, it's much easier to understand where you're going. So my encouragement is just as leaders of organizations, we have to be agents of change. And if we're not green and growing, we're ripe and rotting. And so to try to constantly stay ahead of the curve, and again, I said it earlier in this presentation, I tell you right now in healthcare, wherever your facility is, you have a tremendous opportunity to be ahead of this curve. Healthcare is begging for this and has been begging for better patient experiences. I think those would be probably the biggest challenges, just understanding how you communicate, how you making sure that everybody understands how how important they are to the organization.
Can both or either of you talk a little bit more about how you measure that patient impact, what types of tools you use, and how you continually move your bar so that your team doesn't get stagnant, feeling like they've achieved a goal and get kind of complacent?
Can you rephrase
Either one of you, both of you. Sorry, I'm just asking about measuring, when you're looking at measuring your progress or measuring your patient experience, what tools do you use to know you're on track? And then how, if your organization is doing really well and you're getting positive feedback, how do you continually, do you raise the bar? Do you change your goal so that you can keep staff engaged and moving forward towards the next goal?
I'll give you a couple of things. I'm a huge statistic, because what we cannot measure, we cannot manage. That's why this idea of culture is fun for us to talk about, and Becky and I talked about in preparing for today, that a lot of people talk about it, but nobody measures it. And so that cultural index is a way to measure it. So a lot of organizations will say, oh yeah, we're aligned, we've got a great vision, we've got a great mission, we've got great values, we've got a great code of honor, yeah, we're accountable, we're solid. Well, then we measure it, and they get like a 50%. That's a failing rate. And so again, until you really say, okay, let's measure it. So cultural index is number one. Number two is just using a customer experience index. How are we truly doing from a customer experience standpoint? Plus then also, what are the key metrics that we want to measure, whether it be on a daily basis, weekly basis, monthly, semi-annually, or annually. So for instance, it may be in an organization, one of the metrics that's important is time in the office. So let's take the example I gave you of the doctors that committed to 15 minutes. That was a metric that they measured. And if they knew if they held up to that measurement, they saw all the other numbers downstream improve. Referrals went up. Organizational overall revenue went up. And so looking at what metrics are in the organization are going to drive the numbers the most. I'll give you another one, since this is in healthcare is something that we hear a lot with EHR systems. One of the bigger complaints that patients have is that the doctors or the nurses or the assistants have their nose buried into a computer versus engaging with the patient. So what percentage of the time do we have our nose buried in the computer versus eye-to-eye contact with the patient? So you start to put down key metrics for the organization. Every organization is a little different depending on what kind of service you're delivering, but you got to say, okay, here's where we are, and here's how we get better. And so I think establishing what are those metrics depending upon the discipline and the services that you're delivering.
We work with our clients on a more of a long-term basis, and so that one of the tools that we use and that helps track and measure our inbound processes for marketing is HubSpot. And so through that, we set goals to see whether we're creating more web traffic, and is that the appropriate web traffic. We don't want just spam web traffic from across the world. We want the right customers coming to the website. So building resources that are engaging with those patients that you're looking to provide that educational material to, and the right educational material to. We're watching, are those being downloaded and how often, and what's the response. So we have different ways of tracking and measuring across the board, from, again, the website health, the social reputation. There's many tools that we use. There's not just one. That monitor those different things, and it just depends on what that goal is for the client and where we're trying to take their marketing.
Becky, that just reminded me, too, that Dr. Unruh mentioned a ladder of, can't remember what he referred to it, a resource that you were going to provide. Can you describe that and just go over what that was again?
Are you thinking
the branding ladder? Oh, yes, the accountability ladder. I think that's what it was.
Okay.
Yeah, in fact, we'll send out a copy of this that you can use in your organization. But this is a simple cultural tool. We have this hanging on walls in the onboarding binders, and we teach this in a lot of organizations.
And I just pulled it out from the
computer. So here it is. So it's 10 different steps on this ladder. And as organizations, we want to operate what we say above the line on the ladder. So below the line, it would be statements like this. Ignore or deny the situation, make excuses, finger point, tell me what to do, cover your tail, or wait and see. Because we teach our people of our organizations to say, okay, don't ignore or deny the situation, right? Don't make excuses, and listen to your language. I mean, I use this at home with my children, and my wife uses it with me. Well, where's that fall in the accountability ladder? I mean, you start having some fun with it. You know, finger pointing. Well, she should have done that. Or you didn't tell me what to do. Anybody ever hear that? Or cover your tail. Well, I did my job. She just did her job. You ever hear that? Or wait and see. No, I don't pick up the garbage. Somebody else will pick up the garbage.
I hear that a lot of my kids.
So those are people below the line of the accountability side. And this is just a good visual that we'll share with you all so you can use it. But above the line, acknowledge reality. What's the situation right now sitting in front of us? Own it. I'm gonna solve this thing. Good, bad, right, or wrong. I've been empowered to solve it. If I mess up, we'll figure it out and we'll adapt again. And then number 9, solve it. And number 10, do it. Take action, massive action, and get it done. And so that's the accountability ladder. It's a simple cultural tool. Becky, I think it's been helpful in your organization, right?
Yes, it has. We started kind of implementing this just about a year ago, I think. And it's been great just even for me as a leader of our organization, even just to look at it on a day-to-day basis for my own sake, and actually ask myself, all right, you know what I mean? Am I finger pointing because I'm stressed out and I have so much work on my plate and I'm, or am I actually owning it? Am I solving it? Am I acknowledging the fact that, yep, I got a lot on my plate, I'm stressed out, okay, take a breath.
Yeah. It's a great tool, so we'll share that with them. Yeah, that'll be great.
Well, we are coming up to the top of the hour, and I don't have any additional questions in the chat, so I just want to take these last few moments to thank you both for sharing your insights with us, for sharing your experiences and some great examples for us to take back and continue to work on our own brand in our organizations. Just want to remind everyone that the next webinar in the Patient Experience Series is scheduled for March 19th, and it will feature Matt Jensen from Vance Thompson Vision, and he's going to talk about how to use employees as ambassadors for your brand and your organization. We do appreciate everyone's time today. Please just take a moment as you exit the system to complete the webinar evaluation. And you will all receive an email with a link to the recording, and also the resources that we mentioned will be available through that message. So thank you so much, all of you, for your time today, and Becky and Dr. Unruh as well. Everyone enjoy your day.